Leadership and Management, Classical Views and 21st Century Thinking. When we compare the industrial age and the relationship age in terms of leadership and management, what we see is that early on the focus was on the productivity and the ability of the worker to produce in large quantity whatever the organization was attempting to produce. It had no real interest in the worker as an individual, but more in terms of what their contribution was to the organization. As the relationship age became popular, what we noticed is a very different consideration for the individual worker and how they feel about their job, how they contribute, what they feel like is their purpose in the workplace, knowing and trusting their leaders, and enjoying the work. Management theories began developing, and Taylor is who is called the father of scientific management. Taylor believed that if an organization could find one best way to do something and teach their employees to do it that way, it would increase production. Weber came along and believed in bureaucratic functions as the ideal work structure, and his premise was that if you had a lot of rules and structure and regulations in an organization, you could improve efficiency. Of course, we all know now the word bureaucracy kind of brings absolutely the opposite thought to mind. We tend to think of waste and inefficiency and very difficult to navigate. And yet very often in businesses today, including healthcare, you will see that bureaucratic structure is really alive and well. It's just been modified. Fayol talked about the management process as a set of functions, and we'll look at those in a few minutes. Follet introduced the concept of participative management, which over time developed into what we now know as contingency leadership. And Follet postured that if the authority that was had in the job was shared by the manager and the employee, that it would increase the employee satisfaction. Mayo was a researcher and educator who was commissioned to do a study for a company in Chicago called Hawthorne Electric, and he and his graduate students were supposed to study whether or not the amount of light in the workplace increased or decreased efficiency for the workers. What they found was that as the workers were being observed, they actually improved their behavior and sustained those behaviors because they liked being watched by their managers. Not at all what Mayo and his graduate students had anticipated finding out, but it did highlight that the interplay between the manager and the worker was significant in terms of productivity, and we know that now as the Hawthorne effect. Douglas McGregor in the 60s started doing work on management, and some of his work also led to leadership theories. We'll talk a lot about McGregor in this class, so be familiar with his work. McGregor suggested that the manager's attitudes about the workers had a lot to do on how the employees were treated, and that had something to do with how satisfied they were and consequently how motivated and efficient they were. He labeled Theory X managers those ones who believe that their employees are basically lazy, that they need to be supervised constantly and they need a lot of direction because they really don't care about the organizational needs and they're only there for a paycheck. Theory Y, on the other hand, those managers believe that workers are inherently good and that they enjoy their work. They come to work and they want to do a good job. They're self-motivated and they're willing to work hard. It's more than just a paycheck to them. And then Argyris posed the notion of employee participation and flexibility in the decision-making process and how that helps improve employee satisfaction and thereby their productivity. The evolution of leadership theories took a similar kind of course, starting out with the great man theory and trait theories, which go all the way back to Aristotle type thinking. Great man theory basically suggests that if you have certain characteristics and you're a leader, that you were born with those characteristics, you didn't learn them. Trait theories began to look at what are those characteristics and studied whether or not one could teach someone those characteristics. Behavioral theories looked at the style of leadership management that was used by various individuals and the effect that that had on the group. We will be focusing a lot in this course on the authoritarian leader, democratic leaders, and laissez-faire leaders. The authoritarian leader makes most of the decisions, if not all of them. They have more of a one-way communication, top to bottom, with their staff. They don't really want to hear what staff have to say. Democratic leaders share decision-making with the group, although they do make the final decision. They have an emphasis on we the group, what can we do together. They like to hear back from employees. They want ideas. They want to share concerns and do some brainstorming so that they have more ideas to make decisions with. Laissez-faire leaders exercise very limited control over their group. They pretty much allow the group members to make their decisions and go along their way, and the leader is there more as a supportive role to help facilitate moving resources around and that kind of thing. While you might think that doesn't sound like a very good leadership style in healthcare, it actually, in the right circumstance and with the right group of people, can actually be very effective. If you have a unit that is staffed with highly trained, highly experienced nurses, they really don't need a lot of direction. They know what they need to do, they know how to do it, they know what their resources are, and they go on about their business. So a laissez-faire leader in that type of a situation would be the perfect leadership style. However, if you took that leadership style to a unit that was predominantly brand new nurses, that wouldn't work. It can end up deteriorating into chaos because certain groups need more structure. Situational and contingency leadership theories focused on the need for leaders to change their style based on the situation at hand and the individuals involved. And what you will see through this course and in the different assignments and lectures and things, as well as in the observations you make in the clinical setting, that you will see managers use a variety of styles while they will still have one predominant style. Interactional and relationship theories looked at the relationship between the leaders and the followers and the dynamics of how that works. Transactional and transformational leadership focused on the types of leaders Transactional leaders tend to be the ones who are focused on the day-to-day business and running things, the nuts and bolts, if you will. And the transformational leaders are the ones who are very visionary. They are committed to the organization long term because they do have more long term ideas and visions. They're the ones who are looking for the what next. Where can we go? What can we do differently? How can we be more competitive? Now, it's important to note that having both of those leadership styles in an organization is very important. You really don't need just one or the other. You want a blend of those because someone has to be managing the here and now, the day-to-day, what's going on the units as we speak, while the other people are planning for the future. So you have to have both. And then full range leadership theories suggest that there are a variety of characteristics that good leaders need to have. When you look at what the 21st century leader manager needs in their repertoire of abilities, strength-based leadership is focused on what are the strengths of the group. How do we marshal the abilities of our people? Level 5 leadership looks at successful organizations and how those characteristics that are demonstrated by managers are shared throughout every level of leadership in those organizations and contribute to their success. Servant leadership is very popular, especially now, as we focus more on customer satisfaction in healthcare. Servant leadership is focused on meeting the needs of others, and as a nurse leader, nurse manager, establishing a unit where service is the mindset is part of what service leadership is about. Principal agent leadership focuses on the principal as the leader and agent is the follower, and suggests that even though an agent may be following or someone may be following a leader, that does not mean that that agent might not have some ulterior motive that is actually changing the way the process works or the way the outcomes happen, and that the principal needs to be aware of those possibilities. Human and social capital theory focuses on the abilities of the group members and what can be done to improve those and to improve then the organization as a whole. Emotional intelligence and authentic leadership. Emotional intelligence really is a set of skills that allow an individual to keep aware of not only their own emotions during interactions with other people, but to understand the influence of their emotions on their decision making, on their conversations, their tone of voice, their attitudes, and to share an awareness of how other people and their emotions are at play in the dynamics of those conversations as well. So when we talk about emotional intelligence, we want to remember that a balance of our abilities to understand and moderate our own emotions and to be empathetic to how other people are feeling in those situations will help us make decisions and communicate effectively. Authentic leadership has to do with being genuine and being real, um, having a set of beliefs that you don't just talk about but that you actually demonstrate in your actions. People will watch what you do and they'll remember what you do more than what you say. Quantum leadership focuses, and thought leadership focus on the environment that the workers are in and how that impacts the organization's productivity. So leadership versus management. This is important for you to know the difference and to understand the difference in this course and all the way through the course, because it's a concept that will build and thread through the course. Think about leaders in terms of they're the individuals who operate based on relationships, and managers basically operate on structure and rules and authority. Now, there are obviously some overlaps, but when you see a question on an exam that says a leadership role would be, then you want to think, okay, that's not the power, meaning the authority that the manager has. That's about the people and those relationships. So remember, leaders work more within the context of relationships, and managers work more in context of the structure and authority that comes with their job title. Leaders empower other people and maximize workforce effectiveness, and they do this by camaraderie, by peer support, by teamwork, by role modeling those kinds of behaviors. And we will look at different kinds of power in another lecture, but think about leaders in terms of their power being referent power and personal power, information power, expertise power, things that are inherent in the individual, not given to them by the organization and the job title. Leaders are also very instrumental in helping implement change that comes along, and we'll talk about change in another lecture. Managers guide, direct, and motivate others, but managers can make things happen even when people don't want to do them. Managers can get people to do what they don't want to do because they have the authority to punish and reward. And that's a major difference in the role of a manager and the role of a leader. Managers can also intervene when goals are threatened because they have the authority and the power in the organization to marshal resources, to use resources in a certain way, to sanction certain things, or to punish certain behaviors. There's a greater emphasis on control with managers, whereas with leaders it's a joining of efforts because of those relationships. Qualities of a nurse manager. A nurse manager needs to be a knowledgeable and skilled nurse as a practitioner, so that they understand what it is that bedside nurses are doing on their unit and how that plays out in terms of time and frustration and efficiency and those things. The nurse manager also needs to be competent in all aspects of management. They need to know the business side of healthcare as well. They also need to be excellent communicators, because so much of what they do is going to involve some type of communication, whether it's conflict management, whether it's writing reports, sending emails, holding meetings. They need to be excellent with their communication skills. They need to be effective team builders. They need to understand what builds an effective team, how you get good team members, and how you sustain those team members' efforts. And they need to be proactive in preparing for emerging threats or changes that are coming the direction of their unit, whether they're planned change, whether they're changes that are being embraced by the staff or even the manager for that matter. They need to be proactive in planning and getting their unit and their staff ready for those changes. Henri Fayol, in the early 1900s, talked about management as a set of functions, and we will look at planning, organizing, command, coordination, and control. In the planning phase, an organization determines what is their philosophy, what are they setting out to do, what are their goals, what are their objectives. They set policies and procedures, define the rules, do their short and long-term planning, as well as looking at the costs and how they will have those funds, when they will have them, how they will get them, that kind of thing. Remember that goals are where you want to be and objectives are how you get there. So sometimes we think about goals and objectives as the same thing, but they're really not. In the organizing phase of the process that Fayol describes, this is where structure is given to those plans, such as if you're opening an additional unit in the hospital, you have to decide based on your patient care population what is the best kind of care delivery and how can you group activities so that the goals of that unit are successfully met. Other functions that fall under the organizing process have to do with working within the structure of the organization, knowing what those rules are, and knowing how to use power and authority appropriately, not only one's own power and authority if they have it, but where the power and authority are in the organization should they need support for something. Staffing consists of recruiting, interviewing, hiring, and orienting the staff. You will see now that in many organizations, group interview is now becoming somewhat popular, where several individuals on a unit will participate in the interview process, representing the various levels of staff on the unit, unit secretaries, techs, RNs, and all of those individuals will have a part in the interview. Traditionally, just nurse managers are the ones, or unit directors were the ones who did the interviewing. But being part of the recruiting process, thinking about who you want, what kind of staff you want, hiring those people, making sure that they get the orientation and acclimation to the unit that will support and continue the type of behaviors on the unit that you've decided you want based on the unit philosophy and those things. The directing phase usually has to do with the management of human resources, including things like motivating the staff, dealing with the conflict that comes up from time to time, delegating tasks to certain people, communicating effectively, and making sure that information is shared appropriately along the lines of the unit and in the organization, and certainly to facilitate collaboration. This is especially important as one manages conflict, is to facilitate collaboration so that you can get the people who are involved in the conflict or have some representative authority or ability to change things, get those people together and see if you can't find resolution. Controlling includes doing performance appraisals, which are the topic of another lecture, but performance appraisals are important in allowing staff to know how they're doing on the unit, and it also keeps a manager abreast of the functionality of the various individuals on that unit. Attending to the fiscal accountability, making sure that you are managing the budget, that quality control items are being not only carried out but tracked. as well as legal and ethical controls. That means meeting the requirements, say, of OSHA, HIPAA, those kinds of things. And then the professional and collegial control, which would include making sure that your nursing staff have their CPR certifications done, that the nursing staff have their licenses up to date, that sort of thing. Strength-based leadership focuses on how to develop and empower individual workers' strengths, and things that the manager might do that will foster that is to pay attention to multiple points of view. Don't just keep it confined necessarily to you and your administrative staff on your unit, but listen to the points of view of all of the staff, because this helps you understand better from all the perspectives of the activities on the unit, what's going on, what are the needs, what are the points where inefficiency or structure gets in the way of inefficiency. Searching for common ground so that everyone feels like they've had some say in the process and that their ideas are at least heard. Prioritizing continuous learning in the workplace has to do with continuing to build that quality and support that current knowledge of your staff. And again, promoting collaborative relationships, because this helps all of us grow as we better understand the roles and responsibilities of our multidisciplinary team. We can better use them as resources and identify where our patients might interface with those particular services and benefit the patient. So strength leadership works with the whole, while it recognizes that there are individual parts, there are individual people contributing to this whole team or this whole organization, and that there needs to be an appreciation for each individual and their contribution. It also recognizes the uniqueness of staff, nurse leaders in the organization, and that everyone has their own unique set of skills and the way that they come to the job, their experience, it makes them unique, and that they all contribute. Creates a work environment that promotes nurse health and facilitate their development. Understands the significance of subjective reality and created meaning, helping put things in perspective for our staff sometime. Because it feels one way to us or to a staff member that something is happening or something was done or something was changed, doesn't necessarily make that the reality. The reality may be that this was something we had to do because of some regulation, and it really isn't a punitive thing at any one group. Values self-determination. Certainly we want our employees to function in a manner that is self-directed, that they demonstrate their own initiative, that we aren't the ones driving their train, so to speak. And it recognizes that there is an integral relationship between the environment and the individual, and that where you find as a manager the most effective place for your workers to be is when there's a good fit and you understand their strengths and then you capitalize on those. That goes back to hiring, recruiting, knowing what types of individuals you're looking for, not just someone with a license, but what kind of qualifications, what kind of attitude and personality would be a good fit on your unit and support that milieu that you've established. And then create an environment that promotes learning and recognizes the importance of readiness and timing. A good manager is aware of their employees' needs as well as knowing something about what's going on in their personal lives, so that if an employee is struggling with something at home and it's affecting their work situation, you can take that information that you know about their struggle into context of how you make decisions about them, and when you take action or introduce new ideas or new opportunities. If you know that someone has recently lost a family member and they're struggling with that grief process, probably not a really good time to say, it'd be great if you could get your certification this year, because it's the timing is just not right, and they're not ready to do that right now because they don't have the emotional energy and perhaps not even the time to do that. And again, investing in collaborative partnerships is how we build strength-based nursing leadership. Authentic leaders suggest that in order to lead, leaders need to be true to themselves and their values and act accordingly. This is one of the ways, and we will talk more about power in another lecture, but when we talk about referent power, that's a power that other people give us, and it's based on how we conduct ourselves, whether we are approachable, whether we are deemed trustworthy and honest, people of integrity. And that referent power, we never really know who gives it to us and how much they give, or even when it's taken away, because it's not something that comes with a measuring stick, and it's something that you build over time. This is where authentic leaders really gather their followers, is through that referent power, being seen as a professional, a person of integrity, someone who follows the rules but is willing to question when something isn't right. Aviolio suggests that there are 4 factors that are important components of being an authentic leader. The term balanced processing really refers to an ability to rationally look at information, to look at it intellectually as a term, as opposed to emotionally. Someone with an internalized moral perspective, where they realize that there is a right and a wrong, there is a good and a bad, and they operate from that sense. They also have transparency in their relationships because they are in behavior what they are inside, what their character is. People see that congruence, and they have a sense of self-awareness. They know who they are, they know what they're about, and they are individuals who walk the walk and talk the talk. 5 distinguishing characteristics of authentic leaders. They have purpose. They know what their purpose is and what their passions are, and they use self-reflection and self-awareness to identify those things. They have values, and they recognize that there's a link between what they're passionate about, what their purpose is, and that is linked to their beliefs and their actions. They have a heart, meaning they have genuine compassion for the people around them and for the people they care for. They are relationship focused. They value relationships with other people. They work to not only build those but to sustain them. And they do this not because they are trying to gather any kind of award or promotion. It's because they genuinely care about those individuals. And they are self-disciplined. They practice self-discipline by practicing balance in their own lives. They have a good balance between their personal and their professional life. Some of the differences in leaders and managers. Leaders often do not have a delegated authority but obtain their power through other means. Remember, we talked about relationships versus that formal power that comes from a position in the organization. Managers always have an assigned position in an organization, and with that position comes a source of power that allows them to get done the things that they are required to do and responsible for doing based on their job description and their role. Leaders have a wider variety of roles than managers, and they may have different personal goals because they are not having to follow this set of responsibilities that are outlined in a job description of a manager. Leaders can work more with individual people. They can use peer pressure. They can use influence. They can role model. Leaders are frequently not part of the formal organization. As you're on your units, pay attention to the individuals who people seem to gravitate to them to ask questions. Very often these are not your formal leaders on the unit. Sometimes it could even be your unit secretary, someone who seems to be the go-to person, the person who has all of the information that everybody needs, and not just the nursing staff needs, but the physicians will go to the unit secretary and say, okay, well, where's Mr. Jones' room, and did the lab come back, and how do I print this form, and has Dr. so-and-so come in? Those are your go-to people who have a tremendous amount of informal power in the organization. Those folks are your leaders, and they lead in different ways, so pay attention to who those go-to people on the unit are. Managers, on the other hand, are expected to carry out very specific functions. They have responsibilities and duties that are clearly outlined in their job description as manager. Leaders focus on the group process, on sharing and gathering information and giving feedback, empowering other people, very often through their words and their support, where managers emphasize control, decision making, decision analysis, and results, because that again is part of what they have to do because they are the managers. So good leaders and good managers. The leaders are the ones who are envisioning the future, and managers have the authority and control over some of those resources to coordinate them to make those visions happen. So you see how if we have good leaders and good managers as nurse managers, we have the best of both worlds. Good leaders communicate their visions to those around them, for the people who it's important to let know, and managers optimize the use of the resources, make sure that we are efficiently using what we have, and that we have an idea of what more we might need. Good leaders motivate their followers, and they lead the way, and good managers meet organizational goals and objectives, and they follow the rules, and again, that's role modeling for their staff. Good leaders influence others to accomplish goals. They inspire confidence in them. They take risks. They empower their followers, and they are masters at helping promote change. Good managers plan, organize, control, and direct the activities on a unit, including those activities that are in a planned change, and as necessary they use rewards and punishments appropriately and effectively in order to make sure that the goals of the unit and or the organization are met. So Gardner in 1990 looked at the integrated leader-manager from a nursing perspective. This is the individual who thinks long-term, who looks outside toward the bigger organization, meaning not just your shift or your unit, but how does your behaviors and how does the unit's productivity influence the greater organization. They extend their influence beyond their own group into the organization. Nurses who are who get to be known as leaders, very often you will see them moving on to different committees and becoming more visible in an organization, extending their influence beyond their own unit and their group. Emphasize vision, values, and motivation, knowing what keeps staff motivated, sharing the values and the vision of other people and working towards those. Good leader managers are also politically astute. They know where the power brokers in the organization are. They know how to use those connections and those people's decision-making power and their authority in ways that contribute in a positive way to the organization. And they think in terms of change and renewal, not staying the same because we've always done it this way, but what can we do that makes us better, more competitive, and to provide better care for our patients. So connecting the key concepts for this lecture. It's important to think about how leadership and management roles are different and how they're similar. It's important for you to understand the difference in and yet recognize the overlaps of leaders and managers. Consider how managers and leaders' attitudes and beliefs about workers influence the productivity on the unit, employee morale, the retention, communication, and other things. Think about those attitudes and belief and what would it feel like to you if you were working on a unit where your manager felt this way versus this way. And reflect on how leadership styles affect communication, conflict, teamwork, trust, and the environment. You will also be doing a leadership style assessment on yourself. So it will give you a better idea of what all is involved in being autocratic, democratic, and laissez-faire leaders.